The role of therapy in treating generalized anxiety disorder. Hey friends, welcome back to the channel. Or if it's your first time here, I'm Zachy, and around here we talk all things mental health, self-growth, and how to make peace with that overthinking brain of yours. Let me ask you something. Ever feel like your mind has a playlist of what-if thoughts on loop, and you can't find the stop button? You're lying in bed, tired but wired, just thinking through every worst-case scenario your brain can invent. Sound familiar? That could be a sign of generalized anxiety disorder, or GAD. Today we're getting into how therapy can actually help with GAD, and I mean really help. Not just a talk-it-out kind of help, but actual, practical, life-changing tools that can take your mind from chaos to calm. Let's dive in. All right, so GAD isn't just being a worrier. It's not about being dramatic or overreacting. It's a real mental health condition where anxiety becomes a default setting of your brain. You worry about everything: work, health, money, relationships, even when there's no real reason to. What makes GAD exhausting is that the worry feels constant and uncontrollable. You might feel restless, have trouble concentrating, or feel physically tense, like your whole body is carrying invisible stress. Sleep? Often terrible. Relaxing? Almost impossible. And the worst part? Sometimes you're anxious about being anxious, like a spiral you just can't escape. That's where therapy steps in. It's not about stopping anxiety completely. It's about learning how to work with it, manage it, and take back control. So, why is therapy the go-to recommendation for GAD? Because anxiety isn't just an emotion. It's a set of mental and physical habits your brain has learned over time. And therapy is how we unlearn them. When you live with GAD, your brain is constantly overestimating threat and underestimating your ability to cope. It's like your mind has an overactive alarm system, always ringing, even when there's no fire. Therapy helps you rewire that alarm. It's not just about venting to a stranger once a week. It's about learning tools that actually change how you think, how you react, and how you relate to your anxiety. With the right therapist, you don't just feel heard, you feel equipped. One of the most effective therapies for GAD is cognitive behavioral therapy, or CBT. This is often the first approach recommended by professionals. And for good reason. CBT helps you understand the connection between your thoughts, your emotions, and your behaviors. When your brain throws a worry at you, like, what if I fail? CBT teaches you to pause and question it. Is that thought based on reality, or just fear talking? Therapists use techniques like cognitive restructuring, basically fact-checking your thoughts, and exposure exercises, where you practice facing the things you fear in small, manageable steps. Over time, your brain stops reacting with panic and starts responding with perspective. It's like strength training for your mind. Then there's acceptance and commitment therapy, or ACT, and this one's a total game changer for people who try to think their way out of anxiety and still feel stuck. ACT isn't about getting rid of anxious thoughts. It's about learning how to relate to them differently. Instead of fighting anxiety or trying to suppress it, you make space for it. You say, okay, anxiety, I see you. You can be here, but you don't get to make my choices today. ACT also puts a huge focus on values, like what really matters to you. Whether it's being a loving parent, pursuing creativity, or being more present, you learn how to take meaningful action, even if anxiety is along for the ride. That shift from avoidance to action, it's incredibly freeing. Now, while CBT and ACT get most of the spotlight, there are other therapies that might speak to you, depending on your style and needs. Mindfulness-based stress reduction, MBSR, is all about learning to sit with the moment, to observe your thoughts without being pulled into them. It's like mental yoga, helping you stretch your awareness, slow down, and breathe. Psychodynamic therapy goes deeper into the past, helping you uncover the unconscious patterns that might be fueling your anxiety today. It's not for everyone, but if you're curious about the why behind your thoughts, this might be your lane. And then there's EMDR, originally developed for trauma, but now used in some cases for anxiety too. It involves guided eye movements that help your brain reprocess stuck memories and reactions. It sounds odd, but the science and stories behind it are fascinating. Okay, let's break the myth. Therapy isn't some super formal, awkward thing where you lie on a couch while someone silently scribbles notes about your childhood. It's usually just you and a trained human having a focused, thoughtful conversation. Your first sessions might feel a bit weird. That's normal. But over time, you'll build trust. You might start sessions with, "This week was rough," or "I caught myself spiraling again." And from there, you'll work together to explore what happened and what tools might help next time. Some therapists give homework. Others keep it all in session. But the goal is always the same: to help you feel more in control, more understood, and more connected to yourself. Let's be honest, therapy isn't always comfortable. Sometimes it's frustrating. Sometimes it feels like nothing is changing. And that's okay. Growth rarely happens in a straight line. But here's the truth. If you stick with it, something shifts. You begin to catch anxious thoughts before they spiral. You respond instead of react. You sleep a little better. You trust yourself a bit more. And maybe for the first time in a while, you actually feel calm. Therapy won't erase anxiety completely, but it will give you power over it. And that's everything. So if you're living with GAD or just constantly anxious and overwhelmed, therapy is one of the best gifts you can give yourself. You don't have to wait until everything falls apart. You deserve support right now. Anxiety wants you to avoid things, to stay small, to play it safe. Therapy teaches you to live braver, even with anxiety still in the room. If this video gave you a few new insights, I'd love for you to like it, share it, and hit that subscribe button so you don't miss out on more content like this. We're building a community here, one that talks openly about mental health and keeps things real. Thanks for watching. Take a deep breath, take care of your mind, and I'll see you next time on the channel, @Zakaprat.